A new report says rates of anxiety and depression have grown significantly. It also noted that while there's been a 10% growth in the mental health and addiction workforce over the past year, it remains under significant strain. It comes a day after the government announced a ban on prescribing puberty blockers to new patients, a move one trans woman has described as detrimental to mental health. Here's political correspondent Zane Small.
It's an issue New Zealand First has campaigned on.
We're continuing to fight against the use of puberty blockers in children.
Mr Peters, on puberty blockers, why is that an important issue for you?
Well, have you read the Cass report?
That's a reference to British physician Dr Hilary Cass, who reviewed gender identity services and medical interventions for youth, such as puberty blockers.
The main issue of concern for me was the weakness of the evidence base.
It's the most serious report. It's dramatically concerning.
Well, it's interesting that he should refer to that because the Cass review has been has lots of objections to it raised by the scientific community.
Nevertheless, Winston Peters was quick to claim credit for the coalition government announcing it would halt any new prescribing of puberty blockers, a move he described as a promise kept. The government announced that from December the 19th, doctors will no longer be able to prescribe puberty blockers to new patients, an approach described as precautionary that mirrors steps taken in other countries such as the UK, Norway and Sweden. But a transgender woman we've spoken to who chose not to be identified believes the government's approach will isolate young people struggling with gender dysphoria.
This isn't just some cosmetic thing we're talking about here. This isn't just some fad. This is mental health, and this is something that you just can't mess around with. You know, even me, you know, in my advanced stage of transition, I still have these mental health troubles because I'm still not embodied as I want to be. It
comes as a new health report out today says rates of anxiety and depression have grown significantly. And despite positive increases in workforce numbers, our mental health and addiction workforce remains under significant strain.
We expect Health New Zealand to ensure access for people presenting with gender dysphoria and gender incongruence to the services that they need, both in primary care and specialist services. But we've also agreed that the prescribing of these drugs should be restricted with the absence of the clinical evidence.
It's really important that politicians rely on advice from highly qualified people. And they have not relied on advice from qualified people at all in this instance.
Labour's Rainbow spokesperson Shannon Halbert believes it's inappropriate for politicians to be involved.
Decisions like this should be made by medical professionals, by young people and their families themselves.
But after campaigning against puberty blockers, Winston Peters views it as a victory.